Hi, I'm Dr. Paul. Welcome to another episode of Ask Your Pediatrician. The question for today, we were asked to talk about nail clipping and ingrown toenails. There's sort of two topics with nail clipping. The first one I get fairly often is, how do I take care of my newborn's nails? And the advice that's given at the hospital where we work is you're supposed to file them. But if you've ever seen newborn nails, they're paper thin and flimsy, and I don't know how you would file them. So what I would recommend, now this is a regular size clipper, but what you would do is you would take your baby's nail and you need to make sure you peel back the skin, and whoever's got the steady hand and the steady eye is going to make sure that lower part of your nail clipper is under the nail and between nail and skin, because it's very easy to snip and get some tissue and then you've got blood, and that's no fun. But beyond that, you just start on one side, go to the other side, and then round it out. Fairly straightforward if you've got a good eye, and they make little baby nail clippers. Now I'm going to talk about the ingrown toenail topic, which really has to do with the fact that for most people, you have cut your nails incorrectly and you've left a sharp edge that then stabs into your toe and grows into it, and it breaks the skin. You've got infection. You know, we're covered with bacteria, right? So if you cause a break in the skin, very high likelihood you're going to get an infection. So actually it's a similar style as far as how to cut. So when you're cutting to avoid an ingrown toenail, here's what I recommend. You get your clipper on the side, the edge, and you make your first cut right there. Snip. You then go around to the other edge and get under your nail and make your next cut. Snip. And then you can round out around the nail. Now the key is on this corner right here, maybe you get a file after you've snipped it, and you just file away and you make that edge smooth, because that's the edge that's going to grow into the tissue and create an ingrown toenail. Same with this edge. You get a file and you smooth out that edge right there. Now once you've got an ingrown toenail, that's another whole problem, because you've got, this gets all swollen and red. I apologize, I don't have a great picture of an ingrown toenail. Maybe we'll pop one up for you if we can find one. I see it at least every month. And you've got to soak your toe in Epsom salts. If you can get a little piece of wisp of cotton right underneath that edge so it doesn't grow into the tissue, you can try to do that just to create a little separation, because, it hurts. You've got the skin right here broken. It's getting infected. Soak that toe in Epsom salts, your whole foot if you have to, right? And do that twice a day. If the infection is spreading, you've got redness just spreading down your toe, then you may need antibiotics. It may be into a cellulitis where just soaking won't be enough. But for the most part, you can soak your toe that has the ingrown nail. Try to just let that nail grow out. So I would show you here on an illustration. I've tried to demonstrate a toe here. That first cut goes on the edge like this, the next cut on the edge like that, and then you can kind of round it out. What you may have to do, here's your toe. If you're really prone to ingrown toenails, you have a slightly unusually shaped nail, and it keeps happening over and over again, you let that nail grow out a little further, actually a little bit past the tissue. Once you can get it past there, just don't create a sharp edge on the corners and you're set. No matter how unusual your nail is, let the nail grow out a little further than the tissue and you should be okay. As a last resort, many physicians, podiatrists for sure, they're specialists on feet. They can, I've actually done this procedure. I choose not to do it anymore, but it's pretty simple. You numb up the toe, you then remove a piece of the nail on each side, deaden the root so the nail will grow back narrower, and that can resolve the issue for people who have recurrent ingrown toenails. That's it for today. I'm Dr. Paul. Thanks for watching.